May the court please, we would like to call Dr. Barron to the stand at this point. Doctor, can you tell the jury your name and your medical background?
My name is Dr. John Barron, and I graduated from the University of Dayton in 1964 and got my medical degree in 1968 and began family practice here in Central City in 1969.
But now, Doctor, do you live here in town, do you?
Yes, I do. It's a fine place.
And are you married?
Yes. And,
do you have family?
Yes, I have 3 children. Been married 15 years.
Mm-hmm. And have you always, then, in your entire general practice, has it always been in this town?
Yes, this is where I live, and that's I enjoy working here.
Okay. Now, you decided to be a family practitioner, doctor, and not a specialist. Can you tell us why you decided to do that?
Well, I grew up with a lot of these people, and I've been sympathetic to their needs, and I found that most health care is actually preventive. 80% of the problems that people have I can handle, and when there is a special need for an exotic disease or something, there are enough specialists that I can recommend them. But as I said, 80% of the needs of most people can be met by a family practitioner.
Well, as a family practitioner and not being a, quote, specialist, unquote, does that mean that you don't have any knowledge about fields of specialty such as the field of neurology?
Well, I try to keep current with most of the journals, JAMA, and if during the course of my reading in all fields, sometimes even in Newsweek I'll find an article about something, and it'll refer me to an article in a journal which I'll have my secretary Xerox for me, and I'll look it over at the golf course.
Have you tried the National Enquirer? Now, doctor, in the field of general practice, do you find that you have to have a knowledge about a lot of different fields of medicine?
Well, I have to be acquainted with a number of things, but as I said, there are enough experts and specialists in fields that when I encounter something that I can't handle through medication, I'll call it an expert, yes, or a specialist.
Now, in the course of your work as a general practitioner, as a family practitioner, do you do reading in various fields of specialty?
Yes, I subscribe to, as I said, the Journal of the American Medical Association and Clinical Pathology, but not that many specialty journals do I encounter.
In those journals, are there articles concerning neurologic conditions?
Yes, there are, yes.
And do you read them all?
Most of the ones that interest me, yes.
All right. And do you have an opportunity in the course of your general practice to work with patients that have epilepsy?
Yes, I do treat epilepsy. I've had a number of patients over the past 20 years, and we treat them with medication, and we seem to control their situation.
Okay, and have you found it necessary to refer those patients to a specialist neurologist for the diagnosis of the condition or treatment?
I think perhaps 1 or 2 in the past 20 years.
All right. The rest of them you've treated yourself?
Yes, I have.
And had no problems with that?
No.
Okay. By the way, doctor, do you testify much?
Well, I guess this is perhaps my 3rd time in court. I've testified, I believe, on 2 previous occasions.
And why don't you tell us a little about those experiences?
Well, one time I had to testify. One of my friend's sister fell in a supermarket, and I was called in to testify about the extent of her injuries. And I think about 10 years ago, there was a child abuse case where I was asked to testify about the behavior of the child before the alleged incident and afterwards.
Were these patients of yours?
Yes, yes.
Oh, they were actually patients.
Yes, or they were family members of patients who I had regularly treated.
How did you charge for those episodes of testimony?
Well, actually, I didn't feel the need to charge for these. These were regular people, friends of mine that I felt the need to do a service for them, and they asked for an opinion. It took some of my time, but it was part of. I felt it was part of my general practice to do that. It was part of good community relations.
So you've never been a paid witness?
No.
Giving an opinion for payment?
No, I haven't.
I see. Okay. Now, do you know this family, Jackie's family?
Yes. I've in fact, I delivered Jackie 17 years ago in the back of my station wagon.
Really? And take that. And do you know the rest of the family members, just the father? And
yes, I went to college with Jackie's father, and I have known Jackie. As I said, I've coached him on the grade school football team. His father and I belong to the Lions Club together. His mother and my wife are good friends in the Women's Auxiliary.
And with regard to Jackie, has he been your patient since he was born?
Yes, he has.
And doctor, as a professional, what are your observations of Jackie as a person and as a patient?
Well, he's a fine young ball player, football. The lad likes to do service. He helps out at the boys' camp for underprivileged children who have diseases. He takes care of his little brother who has cerebral palsy, and he's a bright kid, very popular.
In terms of his your observation of him as a patient, is he a good historian?
Yes. The times that I've treated him for flu previously or measles, he's always been aware of his own injuries. He hasn't exaggerated anything. He has a good memory as to what has occurred to him.
Have you always found him to be an honest patient and an honest person in the community?
Yes, I have, definitely.
Okay. Now, have you had experience, doctor, in the course of treating these various people that you've treated over the years for epilepsy, of forming opinions based on your background and expertise as to what caused the epilepsy?
Well, most epileptics that I've treated, we really don't know the cause of it. In many cases, some trauma to the head may cause the onset of epilepsy, but in general we don't know. But we do know that they have seizures which preclude them from functioning, and that medication, in most cases, medication alone will allow them to function as healthy teenagers and adults. You
have been treating Jackie for epilepsy in this case, is that correct?
Yes, I have.
And is he under control with his medications?
Yes, he is. Being an exuberant youth, sometimes he lapses in his medication and has slight focal seizures. But in most cases, yes, he's not going to be what he formerly was. He had a good career ahead of him as a football player, I feel. But now he has it under control.
Doctor, have you formed an opinion concerning the cause of Jackie's epilepsy in this case?
Well, yes, I believe in this case that it was a motorcycle accident.
Okay, And what is it in the motorcycle accident that you feel caused him to develop epilepsy?
Well, he lost consciousness. He hit his head on the pavement. He lost consciousness for a while, and sometime later developed a grand mal seizure.
Well, were there any other symptoms that he had around the time that you considered important in coming to that conclusion?
Well, his parents told me that he had severe headaches, and at times he would walk into walls. That seems to be bizarre behavior, they said.
Okay. So they indicated that there was some strange and bizarre behavior, after the motorcycle accident?
Not immediately. It was some weeks later on. Bizarre behavior at times. He was a very active child, and then all of a sudden he became lethargic and, like I said, just staring into space at times, getting up and walking around for no reason.
Now, let me ask you some questions about this. You have said that you think the automobile accident and the trauma to his head at that time caused this, but actually he was treated at the hospital ER and he was released. So that seems like it was kind of a mild sort of injury. Can that sort of an occurrence where you lose consciousness and have headaches but are released from the hospital, can that cause epilepsy?
In many cases, yes.
Has that been your experience?
Yes.
So you've actually treated patients right here in town where that's been the cause?
Yes, I have.
I see. And as I understand it, he had x-rays, and the x-rays were negative. I mean, they didn't describe any fracture of the skull or anything like that. That's correct, isn't it?
That's correct.
Well, how could it be that he could have epilepsy but not have a fractured skull?
It doesn't always take an open wound to the head to cause the onset of epilepsy. A closed head, without breaking the skin, without fracturing the skull. Many times when blood does circulate more in the brain from a trauma to the head, it does occur.
Well, what is it about the blood circulating in the head that causes him to end up with epilepsy 3 weeks later? I don't understand. If he was going to get epilepsy, why didn't he get it right when he had the motorcycle accident? How come it showed up 3 weeks later?
Well, from my reading, epilepsy seems to be related to scar tissue that forms in the brain after a trauma to the head, and scar tissue doesn't form immediately. It takes 24 hours to a couple of weeks for scar tissue to form.
Oh, so actually you wouldn't expect it to happen right away. It might take quite a while.
That's right.
Well, another thing that concerns me is that the day that you readmitted him to the hospital when he had the seizures and you treated him for the seizures, I noted in reviewing the medical records that he had a fever that day. Can't fevers cause epilepsy, and why didn't you conclude that that was the cause?
Well, he only had a fever of 101 degrees, and I believe everyone alive has had a fever of 101, and everyone does not walk around with epilepsy.
Oh, well, what kind of fever is it that you have to have, in your opinion, to be getting convulsions and have seizures as a result?
If a person gets to have a fever of about 106 degrees, that's the time for putting him in an ice pack.
Oh, that's just you mean like in that situation where the mother is told by the doctor if the fever gets too high to put the child in the tub and in cool water and try to get the fever down?
Correct.
That's what the doctor's telling the mother to do that for. Oh,
101 is normal for everyone in a cold or an infection. 106 degrees is abnormal.
So that's why the doctors don't tell the mother to put the baby in the tub at 101 because there's no icing. Okay. Now, you say here that this was caused by the motor vehicle accident. Are there any things in this case that make you feel that is not the case here?
Well, there were no other causes that were likely to have caused that. There was no other, in his history, as he's told me, no other incidents of trauma to his head that could be suspect.
Let me take you to another subject. You also are, as you've indicated to us, are familiar with his family, and Jackie particularly, and you mentioned you're familiar with him as a ball player. As his family doctor, has having seizures now that are permanent, are they permanent, or might they go away?
They'll be mitigated. He might have them again.
Okay.
But what we have to do is see if he will go without a seizure for at least a year before we can determine that.
Well, is that why you have not allowed him to drive?
Yes.
Okay, so in other words, you've told him that he's not allowed to drive a car at all.
That's right. He must maintain his medication for at least 1 year, and if he hasn't had a seizure in that period of time, I will give him permission to drive.
Okay, but is he going to be on these medications permanently?
I believe so.
And if he can't take the medication for any reason, is there a danger that he will have a seizure?
Yes, there is.
And then he could hurt himself or someone else?
Yes, there is. I wouldn't recommend that he take any dangerous occupation, any job that might involve someone else's safety.
Can he play football?
No, I don't believe he can. He can play football, but his ambition of being a professional ball player or going on to Ohio State, I think are out of the question now.
So you don't believe that he's going to be able to do that?
No, I do not.
All right. Now, have you noticed any problems that Jackie has suffered as a result of having to take these medications, having to take these, and having these seizures occur in terms of his personal life and the way he relates with other people in the community?
Well, he was always a very bright, active boy, and now taking the medication, he complains of feeling dopey, and well, the medications we prescribe for him, Dilantin and phenobarbital, will induce those effects, and especially, he was a very popular young man with the girls in high school, and he feels very insecure about going out on a date, that he perhaps might have a seizure, and he just doesn't feel alert the way he used to.
In your experience in dealing with people that have epilepsy, is that an unusual reaction, or is that one that you would expect under the circumstances?
Yes, I would, for a young man of this degree of activity, to be curtailed by a dopiness and insecurity. Yes, it is.
Thank you, Doctor. No further questions at this time.
Now, my problem is that is this on? This on. Now, my problem is that this very lovable, bumbling old character has charmed the pants off of the jury. Everybody knows him. He's winked as he's come into the courtroom, and he's been not only an expert in the liability aspect with regard to the cause of the epilepsy, but he's turned out to be a very substantial damages witness for the plaintiff. And he's talked about all the problems that he's had, which he knows personally from his contact with the family. In addition to which, Jim, on his direct examination, basically brought out affirmatively every point he knows that I'm going to cross-examine Dr. Barron about. So my objective now is to go over his qualifications and try and point out the flaws of his testimony without alienating the jury, and also to try and work something on the damages that this expert turned out to be. Good afternoon, Dr. Barron.
Good afternoon.
I'd like to go directly to your opinion about the cause of Jackie's epilepsy, and I'd like to begin by asking you a few questions about your background and prior experience in epilepsy. Is that all right?
Sure. Happy to help out.
Now, Dr. Barron, as I looked at your CV here, I see you had 1 year of internship, and you had, how many years of residency did you have?
1 year.
No, I think it says here you had no years of residence. You had 1 year of internship.
1 year of internship.
Right. It's hard to remember sometimes. And then you went right into private practice after you had only 1 year of internship. Is that correct?
Yes, I did.
And then you've been in general family practice since 1 year out of medical school.
Yes, since 1969.
Right. And Dr. Barron, you're licensed in this state and no other states in the country. Is that correct?
Yes, this is my home. This is where I choose to practice. I don't feel the need to go to a number of other states.
And it's true, Dr. Barron, that you're licensed. You've been granted privileges at General Hospital here in town, and you have been granted privileges at no other hospital in the country. Is that correct?
That's true. That's all I require for my practice.
And family practice, doctor, is... tell the jury what family practice is.
Well, I do everything from the young children to the old folks. I'm the primary care physician, taking care of 80% of the problems that afflict the human body.
So you certainly, despite your extensive reading in Newsweek and others, you're not an expert, according to your own definitions, in neurology. Is that correct?
Well, I'm not an expert, but I try to read in the field.
And you do, when you feel the need to refer out to an expert, refer people out to people whom you consider experts in the field. Isn't that correct?
Yes, but that depends upon the individual case.
For example, in Jackie's case, you referred him out for a EEG exam, and you referred him out to an expert, Dr. Diamond. Isn't that correct?
Yes, I felt the need that if we were going to run an electroencephalogram, that Dr. Diamond would be the person to handle that.
Because he's an expert in that field. Isn't that correct?
Well, I guess you could say that.
And epilepsy, of course, is falls within the specialty of neurology. If, Dr. Barron, you felt it was necessary to refer out an epileptic patient of yours to a specialist, I suppose you would look for someone who is board certified in neurology, for example, like Dr. Rosenberg.
Well,
isn't that a quality that you'd look for?
Well, I suppose board certification is a qualification, but I treat epileptics all the time.
Well, board certification is something that's recognized by your peers in your fields as a specialty. Isn't that correct?
Well, people who publish articles on those subjects usually are recognized as experts, I guess.
So you would also look for someone who has published articles in neurology in journals other than Newsweek, like, for example, Dr. Rosenberg has. That's generally considered acceptance by his peers of an expert. Isn't that correct?
Well, in many cases, yes.
And I suppose it's another characteristic you might consider in selecting an expert to refer a complicated issue of neurology out to is whether someone has had fine training, like at Harvard, and generally respected by neurologists throughout the country. That's something you would consider, is it not?
Well, I would suspect that someone trained at Harvard would be a qualified in many fields, but I've also known a lot of jackasses who've gone to Harvard.
Dr. Barron, now, by the way, Dr. Barron, I see you brought your file with you.
Yes, I did.
Okay, could I see glance at your file here? I see this is a script that's
it's not a,
prepared by Mr. Bostwick, I think. Okay, next question. Now, in this particular case, Dr. Barron, you did not refer Jackie Fulbright to a specialist in neurology. Isn't that correct?
That's correct. I've treated a number of epileptics in my career.
And in this particular case, however, Doctor, the issue which you've testified about, and which is the central issue to this case, is the cause of Jackie's epilepsy. You would agree with me, wouldn't you not, that that the cause of epilepsy is a difficult and sometimes very complicated scientific question, and that is an area which, because of a particular expert's training, experience, would be able to render some light on that subject. Wouldn't you agree with that?
In most cases, in many cases.
Wouldn't you agree that a neurologist's opinion would have some substantial value on the particular scientific issue of the cause of Jackie's epilepsy?
Well, perhaps he would, perhaps.
And in fact, Doctor, because in your profession, neurologists generally are specialized in that field, recognized by their peers, wouldn't you have to defer to a neurologist if his opinion differed from yours?
Well, that depends. Not always.
Well, doctor, isn't that precisely what you do when you refer out a patient of yours to an expert? You're deferring to his opinion. Isn't that correct?
Well, in many cases I agree with it. I ask him to confirm an opinion. It's not often that I'm contradicted. Doctor,
let's turn for a moment to Jackie Fulbright's case. Now, I take it, Doctor, you were not the treating physician on the day he was brought in from his automobile accident on August 14th, 1988. Isn't that correct?
No, I was not.
And he was treated by the emergency room doctors?
He was treated there and released.
And this is a small town. You know the emergency room doctors that treated Jackie Fulbright, do you not?
Yes, I do know some of them.
And you know that the particular doctor in this particular case who treated Jackie was a competent doctor?
I believe so.
And is there any reason to believe that you should doubt their examination of Jackie Fulbright?
Not that I can think of.
Well, Doctor, Jackie Fulbright, as he came to the hospital, from the time that he was seen until the time he left, was there 1 hour and 50 minutes. From viewing the medical record, doesn't it appear that it was a very minor automobile accident requiring minimal treatment, and then he was released, just looking at the medical records?
It would appear so.
And although he had some minor abrasions, he had a headache. Isn't it true, Doctor, that at the time he was examined, he had an absolutely negative neurological exam?
I guess so.
And I take it, Doctor, wouldn't you agree that because there were no findings whatsoever of any neurological deficit following the automobile accident, that he simply did not present at all the picture of someone who had had brain damage of a traumatically induced epilepsy?
Well, it wasn't the classic case of epilepsy, but these things take time. It's not an instantaneous reaction.
Well, in addition to the fact that he looked normal, and he presented in a fashion which, as you say, is not the classic presentation of a person who had been brain damaged, wouldn't you agree that the sole basis of the opinion that you've expressed on direct examination is the fact that he lost consciousness?
That's one of the factors.
But Doctor, isn't that really the sole factor? He had a normal neurological exam, he had a normal X-ray. The only thing that was abnormal, at least from your original examination, was the fact that he lost consciousness. Isn't that correct?
I would guess so. I suppose it is.
And I take it you relied upon the medical records of the emergency room for your conclusions as you wrote the discharge summary in this case?
Yes, that's true.
Doctor, if I were to show you evidence that maybe Jackie Fulbright may not have been knocked unconscious, or his loss of consciousness was questionable, then wouldn't you have to change your opinion?
Well, it doesn't seem to indicate that, but I believe he was knocked unconscious.
My question was, Doctor, if the sole basis of your opinion is that he was knocked unconscious as to the automobile accident causing the epilepsy, wouldn't you have to change your opinion if I were to show you evidence that he had been knocked unconscious, or it was questionable as to whether he had been knocked unconscious?
Well, I suppose I would have to reconsider.
Okay, Doctor, I want to show you, and then I would walk over to the transparency and put on a transparency of the medical record, which provides, if you can see it, there's a question mark just in front of the loss of consciousness. Doctor, if you direct your attention to the TV there, you'll see that the doctor wrote questionable loss of consciousness.
Well, I really didn't see that, but I still think he got it from the auto crash.
Dr. Barron, isn't it true that epileptic seizures caused by trauma are usually found or experienced within a short time of the injury?
Well, yes, that's usually true, but not always.
Jackie, of course, had no seizures at all following the automobile accident. He was there for an hour and 50 minutes, normal neurological exam, normal x-ray, and then he went home. Isn't that correct?
Yes, that is correct.
And it wasn't until 3 weeks later, after he got another bump on the head, that he started having the seizures, correct?
Yes.
Now, wouldn't you agree with me that because his seizures occurred right after he got bumped on the head at the football field, that just from a timing standpoint alone, that the football injury is more likely implicated as the cause of his seizures? Wouldn't you agree with that, just from a timing standpoint?
Well, the timing would seem to indicate that.
Okay, now, Doctor, you testified that convulsive seizures were something that you did not think was a factor in this particular case. You remember testifying about that on direct examination?
Yes.
And you're well aware that Dr. Rosenberg, the eminent neurologist who will testify soon, believes that they are implicated. You're well aware of the fact that at the time he had this first seizure, he had an extensive urinary tract infection. You're aware of that?
Yes.
He had an elevated white blood count. You're aware of that?
Yes.
And you're aware that he did have a temperature, did he not?
Yes.
And in fact, his seizure was his temperature was not taken until he got to the hospital. Isn't that correct?
Yes, and it was 101 degrees.
But the time he had his, but we don't know what his temperature was at the time he had his seizures a short time before, do we?
No, I guess we don't.
And it's well established that grand mal seizures can occur from high fevers and raging infections. Isn't that correct? You know that as a doctor, don't you?
Yes.
Doctor, you testified on direct examination that many of your patients who are epileptics don't have any trauma that's caused it. Isn't that correct? You remember saying that?
Yes.
And in fact, over 50% of the cases of epilepsy are idiopathic. Isn't that correct? Not caused by any known cause. Isn't that true?
It's a difficult disease, yes.
But many of your patients, in fact over half of them, there's no known cause for the disease. Isn't that correct?
Well, yes, I guess there is. We don't know a lot about it.
And the usual onset from the literature is teenage years. Isn't that correct? Just like Jackie Fulbright.
Yes, but that doesn't really cover this. It's a coincidence.
Dr. Barron, you've been a long-time family friend of the Fulbrights, haven't you?
Yes, I have.
You've known the family, and you care a great deal about them.
Yes, I do. I've known them all.
And, Doctor, you almost feel like they're your own personal family, don't you, Dr. Barron?
Well, all my patients are my family. That's why I like living here in Central City.
And you've taken a special interest to nursing him back to health. Isn't that correct?
Well, I've known him and his father for most of their lives.
And he's doing quite well under your care, is he not?
Yes, he is.
And in fact, he's making better grades before he had this alleged brain injury. Isn't that correct?
You can't always correlate better grades depending on attitude. It depends on a number of other factors.
But wouldn't you agree, Doctor, that Jackie Fulbright has a limitless potential for the future?
No, I'm sorry, I wouldn't agree. He has a limited potential for the future.
Wouldn't you agree, Doctor, that he can pursue almost any profession except operating machinery in the conscripts that you've mentioned on direct examination?
Well, he couldn't get into anything life-threatening or dangerous machinery, but he could do something easy like being a defense lawyer.
Who are sometimes better qualified with a brain injury. Now, Dr. Barron, you've testified that this family is, the Fulbrights are almost like family to you.
Yes.
You've taken care of them for all these years, and you'd
Yes.
do anything for them, wouldn't you?
Yes, I guess I would.
And Dr. Barron, as you're sitting here today, you want Jackie Fulbright to win this lawsuit, don't you?
Well, I think for him it would be better if he did, because he received this injury, and it's. If
you want him to be compensated, do you not?
Well, yes, I do.
And just sitting there because of your affection to the family, you want him to become compensated regardless of whether my client had anything to do with causing his epilepsy. Isn't that right?
I don't feel it's. I feel that he should be compensated for the injury he received from your client.
Dr. Barron, you've testified that Jackie Fulbright, when he came into the hospital, didn't present a clinical picture of a traumatically induced epileptic. You testified that the timing of the seizures didn't seemed to point more likely to the football injury as a source. You testified that he had a serious infection. You testified that over 50% of the epileptics aren't even caused by any traumatically induced injury. Now, doctor, if you take all those factors together, and you...
Excuse me, counsel. There's an objection been made that the question is argumentative and it's sustained.
Dr. Barron, let me ask you one. Dr. Barron. That's right. We're changing seats next on your... Dr. Barron, if you assume all those facts that you've testified for earlier, I have one final question for you. If you put all of those things together, and you put away from your mind your own personal affection for this family and the desire that you want them to win this lawsuit, wouldn't you have to conclude that as a result of the way he presented no positive findings, that my client had nothing whatsoever to do with this accident?
Well, there are...
No further questions.
Just a few points I would like to, as an aside, now, of course, having put such a witness on, I probably would be malpractice as a matter of law. Whoops. Malpractice is a matter of law for putting this guy on. Anyway, so I'd try to come back and do a little bit of redirect at that point since he's been destroyed. Doctor, you like all of your patients, you indicated to us.
Yes.
That's why you went into family practice.
Yes.
That's why you stay in this community.
Correct.
And you like Jackie very much, don't you?
Yes.
Yeah, and so if there was any way you could tell this boy he could go back and play football and get a scholarship, you'd sure tell him that, wouldn't you?
I certainly would.
And if there's any way you could get this boy back driving a car and seeing the girls and having a good life, you'd tell him he could do that, wouldn't you?
Yeah, I certainly would.
And is it difficult for you to tell this boy he has to change the way he acts the rest of his life?
Yes, I had great hopes for him. He was the star quarterback of his grade school team. He was progressing very well in high school. And I felt he might have had a great career in the pros. Get into Ohio State University. But now he's limited. He can play in junior college, perhaps. I don't feel he can turn into the leader of a man and the admired figure that his father was, or the great potential of a good football player. His career is dashed.
And Doctor, further, is there, under the circumstances here in this community where you've known everybody for all these years, Doctor, under any circumstances, would you ever consider coming in under oath and testifying that Jackie's injuries were caused by an auto accident if that was not your solid professional opinion?
No, I would not. I firmly believe that in this case.
All right. Now, they mentioned the point about timing, and he didn't bother to mention the question about a traumatically caused injury. If a traumatically caused injury results in scar tissue, does that take time to form?
It takes approximately 24 hours to 2 weeks for scar tissue to form in the brain, and this scar tissue causes the imbalance that we know as epilepsy.
One other point. Counsel asked you whether if there was a high fever and a raging infection, might that cause epilepsy? And you, of course, said yes, did you not?
Yes, I did.
Do you see absolutely any evidence anywhere in this case of a high fever with a raging infection?
No, I do not.
Okay. And then one other point. He read you from the emergency room record where there's a question mark in front of loss of consciousness, and asked you to assume, because of that question mark, that there in fact was not a loss of consciousness, a lawyer hypothetical question. Do you recall that?
Yes.
Okay. Now, I would ask you to refer to your written report wherein you took a history from Jackie as a patient back before there were ever any lawsuits here. And did Jackie back then tell you that after the accident, he woke up in the ambulance?
Yes, that's one of the indications of an unconsciousness. If a person hasn't been unconscious, they know that. But when they suddenly wake up at a different place, there has been a loss of consciousness. And they really aren't able to determine how long it was for.
Okay. And was that part of the basis of your opinion, that there had been a loss of consciousness here, and so therefore an obvious connection with the trauma?
Yes, the fact that we knew unconsciousness had taken place. It's just that, as I look at that again, the question mark, they didn't know for how long he was unconscious.
Okay. So that the question mark really is they didn't know whether it was 30 minutes or maybe even an hour.
No, the ambulance got there after he was unconscious, I believe, or I guess when the ambulance got there, and then he woke up in the ambulance. How much time elapsed, no one really knows.
And the final question, doctor, is when you say that 50% of the cases are idiopathic, what idiopathic means is there's no known cause of the condition, right?
That's correct.
Medical science looking at it can't say, aha, here, this is the reason. They don't have a reason, right?
That's correct.
And in this case, you've looked at this and you have said, aha, there is a reason, haven't you?
I've noted that there was unconsciousness, and in my opinion, that is one of the primary things that you can point to indicate epilepsy.
So this doesn't even fall in the category of idiopathic?
No, it does not.
Okay, thank you.
No, I was going to you guys want to talk about
I wanted to say a special thanks to John Bayless. His company is called Bayless Videography, and they do shorthands, transcriptions, and great video work. He does it all for our office, and he really took out a lot of time to do this for us.
We're going to withhold our acknowledgement of the lawyers because they've still got one more witness to do. But let's talk about, if I may, for a few minutes, what we just saw, because there's a lot of stuff that we can learn from what we just saw. We start off on the direct, immediately waving the flag of the family doctor, and we're basically going with what we got, and that's always our situation.